Hi, this is Dr. Brian Castelein with Brighton Foot and Ankle, and in this video we're going to go over shin splints or anterior tibial tendonitis. Now this is a really common injury, especially for our high school athletes, and it tends to happen most in our spring sports. Track, soccer, lacrosse, these repetitive running sports are typically where we see anterior tibial tendonitis or shin splints. And if you've ever suffered from this, you know that it can be really painful. It can sideline you for a significant amount of time and just cause general movement really painful into the front portion of your shin. Now, the anterior tibial tendon and muscle is a really strong complex in the front portion of your shin. The anterior tibial muscle is going to be just located just to the outside portion of our shin, or the most front portion of our shin. Now this tendon and muscle are going to come across the ankle and attach onto the inside portion of the foot, making them a very dynamic and strong complex to help bring the foot up. Again, our overuse injuries such as running, lacrosse, track and field, where we need these powerful motions, are going to cause a lot of tendonitis. Tendonitis can be frequent, but thankfully a rupture of the anterior tibial tendon is really infrequent. This is going to mostly happen from injuries like a laceration or a cut to the area. Now, in our experience here in our clinic, though, we did see a middle-aged woman who just ruptured her anterior tibial tendon last year. But she was in this little niche, this small group of people where they have a little bit of arthritis coming across the mid portion of her foot, and that tendon frayed or ruptured on her, especially after a history of skiing and being in ski boots. So outside of kind of a fluke accident for a small group of people, rupture really isn't a thing. But the inflammation and the tendonitis can really slow you down. What do we like to do to treat anterior tibial tendonitis? Well, it sounds a little goofy, but we actually focus on the back portion of the foot and the leg. That's where we have our Achilles tendon and our calf muscles. Those calf muscles tend to overpower the front muscles of the foot, making them work harder. So as a primary treatment for shin splints, we're going to focus on the back of the muscles. The softer, the longer those muscles are, the less work the front muscles have to do for us. So our stretching exercises, again, of the calf muscles, the hamstring, those are going to be really important. Also, that anterior tibial tendon helps lift up the inside portion of the arch, helps stabilize that area. So as a second portion of treatment, we love to come down and put a nice strong orthotic, supportive shoes to help stabilize the underside of the foot and take pressure off of that tendon. Also, massage, ice, NSAIDs or anti-inflammatory medication can help reduce symptoms of anterior tibial tendonitis and get those pesky shin splints to go away. So this is a great place to start with focusing on the back of the foot and the leg, with focusing on putting orthotics into the bottom, and taking maybe a little bit of rest from your activity can help the tendonitis calm down and get you back into your sports.